Hi, Bill. Lovely to see you back again this week. We
Hello,
had some
Jackie.
really lovely responses from last week, people saying how
Good.
interesting this was. Funny enough, no questions about any illness particularly, but we had a few more from last week that we did want to cover this week. So,
Always plenty to cover, Jackie, yourself.
always.
Always. Um, I think this is a few years ago. There was about 5,000 ailments known to man.
5,000.
In reality, there's only about 2,500, if there is 5,000, in G&M world because of the two phases. One phase, they get symptoms that are conflict active, so to speak, the conflict still going on. And the other half will be healing type symptoms, inflammation, swelling, discharge, pain, all that sort of stuff. So they're classed as different phases and the different organs, tissue types, and all that sort of stuff. So we look at them differently from the medical world does. But if they say there's over 5,000, you got lots to choose from.
Without a doubt. And honestly, so this is Bill Tucker again, German New Medicine. I went to a few sessions with him just over a year ago, 18 months ago, it might have been. Anyway, once a month for 6 months. And it was just so interesting. You could talk about anything.
That's a year and a half, Jackie.
Yes.
The dementia's getting to you already. Come on, go.
So anyway, yeah, it was just so interesting. Doesn't matter what come up for anybody, and then we'd say to Bill about it, and he would give German New Medicine analysis perspective of it. Yeah, so really interesting. Anything you can. So someone said to me the other day, someone very close to me said that she has got. So we're all right to start with this one, Bill.
Yeah, absolutely. Whatever.
Okay. Because she's related to me, she said she has hypermobility Ehlers-Danlos syndrome, which is HEDS. And that's a genetic connective tissue disorder characterized by joint hip hypermobility, joint instability, and chronic musculoskeletal pain. It goes on about stretchy skin, easy bruising, fatigue. Diagnosis is clinical as no genetic test exists. And then there's a lot more I could say about that. But anyway, so then before we come on, I spoke to Bill about that. And I'll let you just say what you want to say about that, Bill, because she actually thought I would probably be affected with this because she also said it's genetically, when you take it from your
Passed on,
parents.
sort of thing.
Yeah. And I know German New Medicine's got something about that as well. So yeah, lovely. Could speak to that, Bill.
Good old genetics. You know, we've been told a lot in our life. Some it's true and some it's not true. Okay. And excuse me if you can hear the noise, any noise in the background. I'm in the Philippines and South Philippines just now, and it's in the rural area, so to speak. And there's everybody rides about scooters, and there's guys ride about scooters with big loudspeakers in the front selling fish or chicken or whatever from the scooter, and the freezer boxes, and they come around all the time.
Honestly, I can't hear a thing other than you.
Oh, that's good. That's
Yeah,
good.
yeah.
I have to keep the door shut. It's just so hot. I have to keep the door shut because it's like the noise, the barking dogs, 24-hour cockerels, and the loudspeakers and the karaoke. Don't forget the karaoke. Oh my gosh. Do you love that karaoke? Oh my God.
And that was the thing we spoke about while we were doing that course with you, Bill. You're not one for noises.
I've got headphones everywhere.
Oh, how funny. But anyway,
Everywhere.
yeah, so it's a challenge.
But I'm moving to somewhere different. This is only temporary for 2 or 3 months at a time of feet. And I'm moving somewhere else, which is definitely quieter most of the time, which is great.
Brilliant.
So this, what's the initials for this thing again, Jackie? H something?
Let's just see that again. hEDS, but it's a small h and capital EDS. So the main one is EDS that most people would know, Ehlers-Danlos syndrome. But the one my relatives got is hypermobile Danlos syndrome.
Okay, hypermobility sort of thing.
Yeah,
So let's get through some of the symptoms one by one, Jackie, because in G&M, there's a lot of names out there that are diagnosed. And as soon as you see syndrome at the end of something, it's a collective of symptoms. Always. There's one syndrome in G&M, and I'll explain that a little bit later, but it's really specific. But in the medical world, syndrome is a catch-all term for the cynical part of me was saying to get as many people into the net as possible to feed them drugs. Okay.
right.
That's the cynical part of me. So bear with that part.
Mm-hmm.
Now, the other part of me, I really care for people. And it's really, really hard when you get something that's either rare or it's genetic and it's described as that, because that makes you feel as though, I've just drew the wrong card, I've rolled the wrong dice and it's no fault of mine. And it's really hard on people because then they fear passing it on to the children, or someone in the family fears it getting passed on to them or whatever. Now, there's probably only one or two things that could be termed genetic, and I'll have to look this up, so don't quote me offhand here, but I think you both find out in the womb. Now, I'm not one for ultrasounds and testing the birth of, the sex of a baby and all that sort of stuff. That's could be extremely challenging to the baby because for a split second it can't hear the sound of the mother's heartbeat. And that could cause a powerless conflict, which can affect the musculoskeletal system. So they come out with one part of the body just not working because they suffer a motor conflict. They're even freeze in that shock a split second, because a baby can hear more than the mother can hear in the womb. The baby can hear more in the womb than the mother can hear.
Yeah.
It's just like being underwater and you can hear sound. And a baby's in amniotic fluid and it hears so much more than we can imagine. And it also takes on the senses of the emotions and the hormones from the mother. And it has its own perception as well. So it can get massive shocks in the womb from any loud, sudden noise. It's, remember, we're programmed from a very, very long time ago, whoever knows how long. And those programs are still running in us as human beings in the present tense. And massively challenging. But there's a couple of issues that could be termed as genetic in the womb. I'll look it up, Jackie, for another time.
Mm-hmm.
Apart from that, genetic, let's just play the card as overplayed. Vastly overplayed. And I've said it many times in the workshop, I don't know if you remember, if someone asked me about the genes, I would say the only thing that runs in your genes is diarrhea.
Yeah. Yeah.
And no disrespect to anyone who's been diagnosed with something that's genetic, okay? I have to look at the collection of symptoms. We never look at the collection of symptoms in G&M because the body's stunningly specific. Stunningly specific. So, those sort of symptoms with someone close to you, any musculoskeletal system, anything that's going on with the musculoskeletal system, as in the muscles, the lymph, the blood, the bones, cartilage, tendons. This is all to do with self-worth. When the self-worth issue is running, for a lady, it may be self-worth more connected to her identity, how she feels about herself, or how she feels that other women view her, usually women, mother, sister, friends, everyone else, not usually men. That's a different type of issue. Men, generally speaking, get their self-worth externally from a doing thing, a sport, a job, a hobby, whatever it is. So, but we both get self-worth. Women tend to have more predisposition to it than men, because they feel more in lots of ways about their person, who they are. Lots of men wouldn't care what you thought of them. They just wouldn't bat an eyelid.
No.
And you say, you know, such and such doesn't like you. You go, and
Yeah, yeah, totally get that. Yes, judging ourselves as well for what we think others are judging us.
this is a trap
Mm.
because they're not judging you at all. They're too busy fearing other people judging them to be worrying about judging. You know, it's just like crazy. Everyone's doing the same thing. So this self-worth stuff, that affects anywhere in the musculoskeletal system. The lymph is the mildest self-worth we could have, okay, depending on where it is in the lymph. There's never a serious issue with the lymph, ever, 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 ever. Never let any medical person frighten you because of an enlarged lymph. It's enlarged for a biological purpose to improve the function of that lymph temporarily, either to facilitate with the drainage or to facilitate faster healing for another organ tissue that's very close to it. Maybe a woman can through a big breast tissue and the lymph will be enlarged beside that breast. It's a perfectly normal reaction. Now, what will happen, there's no such thing as cells spreading or migrating to the lymph. It's physiologically possible. Now, the lymph is enlarging so it can perform its function better, just like someone going to the gym, lifting big weights so they can be stronger or bigger to fight an adversary or lift heavier weights. That's the function. And when they're no longer needed, they reduce back down again in size. The lymph don't always reduce completely in size. They may always be enlarged, but perfectly fine. Never a problem. Deal with any lymph drainage that you can. All good. That's the best you can do mechanically. And apart from that, so that's the minor self-worth. Muscles, tendons, ligaments, a bit of a deeper self-worth. We have to look at a specific part of the body as well. What's the function of that specific part of the body for that person at that time? So if a tennis player with a right hand or left hand, whatever, or a footballer with a right knee, left knee, whatever it is. So you have to look at the function, or maybe a lady with dexterity with her fingers, fine needlework or something, or a musician playing an instrument with the fingers. That part of the body could suffer more self-worth conflicts than anywhere else, because that's the part they feel judged, or fear being judged, or judge themselves on. So the tissue will break down, microscopic tissue loss, for the purpose of when we resolve that self-worth conflict, that tissue now grows stronger and thicker than it was before. So it's able to deal with that. It's perfect. Exact same what happens when you break a bone. That bone is now the strongest bone in the body. So if that ever happens again, it's ready for it. So as long as it's got enough time to heal. So musculoskeletal system, when you get to the bones, that's about as deep as you can go. That's a really deep self-worth conflict.
Mm.
So when you talk about the hypermobility, they're on a hanging healing. They're in and out of this self-worth conflict in whatever area of the body. And eventually it could become general, so to speak, with the self-worth rather than just specific. Okay. So that's just one part. The bruising part, that's more, could be termed self-worth, but it's the blood itself, blood vessels, and again, that in and out of this self-worth conflict. and they may have some anemia going on in either conflict active self-worth or in the healing phase. There's the healing phase in the bones is a little bit more complicated. There's 4 distinct phases. We have different symptoms. So it can be in and out self-worth conflicts in that area and improves quite easily. So that'll be the self-worth. So clean up our act with the self-worth, really. Because you need strength in those tissues to support the bones and the joints. Which is really important. So the other symptoms, Jackie, what else did you mention?
Yeah,
This ED.
so it said joint issues, loose, unstable joints frequently dislocate or sublate.
That's the self-worth because you're losing tissue all the time,
Yeah.
and they're really sensitive to breaking.
Skin manifestations, soft, velvety, hyper elastic skin, fragile, bruises, heals slowly, systematic symptoms, chronic pain, external fatigue, cardiovascular issues.
Just stay there a second, Jackie, please.
Yeah.
Chronic pain. Now, let's just keep it the musculoskeletal system just for now, then we'll go elsewhere. The musculoskeletal system, the pain will be in the healing part, always. It's when the tissue is refilling, because initially you're losing a bit of tissue, like going to the gym, breaking down your muscles, then the tissue for the next few days starts to refill. That's the pain that you suffer post-workout. And especially if you haven't exercised for a while, then you suffer more pain. Or if you do too much, or going out gardening for the first time of the year, doing the heavy gardening work, and then you get the pain later that night or the next day or the next day. You've done too much because you're not used to that exercise, using the body parts, in a way you haven't done for the winter. We've all done it. So the pain is the inflammation, the swelling. That's the healing. But if you get in and out of this program, conflict active, self-worth, feeling better about themselves, healing, then they'll get in and out of this pain cycle. So it's really hard. That's one type of pain, but there's loads of other types of pain. To have to differentiate even every different area. But if it's in the muscles or the joints. And the joints, you can have a really big severe conflict going on with the term a brutal separation conflict, which affects the tissue, the skin around the bone that sort of supports the bone. And that is endowed with a lot of nerve endings, super painful, sharp, stinging pain. And that tissue is called the periosteum. And it's there to support the bone in the outer part. And if somebody gets have brutal separations associated with that part of the body, the pain will be pretty intense. And also if they're carrying excess water, if they feel abandoned, pushed out, left out, excluded, then that pain will be amplified. Always.
Gosh, that's making so much sense to the person I know.
Yeah, and if I was chatting to someone with these type of symptoms, the first thing I'd work on is this part of the kidneys. So 3 different parts, but this part is what they call the kidney collecting tubules, which are little containers that are woven into the tubes that come down from the kidneys, urethra, down to the bladder. And they determine how much or how little urine we output, how much we pee. Now, if we're not peeing as much as we're drinking, we're water, really, rather than anything else, then our body's hanging on to water. And it's almost feeling like a refugee or a fish out of water or struggling to get your head above water. And your body will It could be financial concerns. It could be feeling alone. It could be feeling pushed out, left out, excluded, different. Then someone could retain more water. Even having a tiff with your partner could be enough. Or you wake up and your rings are a bit tight, your shoes are a bit tight. What's going on? Now, the best thing to do is check how much you pee compared to what you drink. Really, our body, if we're eating, drinking normally, without excess water, without, minimum water, just with normal water and stuff, then we really should be peeing out at least 1.5 litres, 2 litres a day, at least. And if we're not, then we may be retaining water, and because you feel a bit bloated, a bit heavy. When you look at parts of your body, you think, so that maybe you look at your ankles or your feet or whatever, you're carrying a bit of water into the abdomen or somewhere else, then that's that part of the kidneys that's active. But the good thing is, you just have to resolve the conflict, or get in the sea, or Epsom salt bath, just warm, not hot. Pee out the water. You always go for a pee when you're in the sea. So don't go in the sea with someone else who's just gone in, because it's just going to pee around about you. Just don't do it.
Why,
Women deny
Lordy?
it, by the way. All women deny it. Men take great pride in it. Oh, look at me, I'm peeing in the sea.
Honestly, I don't know if to share this with you or not, but you would have heard about it, Bill. But I'm speaking to a girl recently. She gave a talk at the beginning of this month, and I was supposed to go. I couldn't go for some reason. I can't remember. But actually, I was quite pleased I couldn't, because she talks about the benefits of drinking a pint of your own pee every morning.
That's a full-on pint.
She literally, oh my goodness, I was glad I didn't go. But she says there's a book about it, and she sent me a video as well, that it's such a good thing to do, apparently. But the very thought of it, oh my goodness. But there is a whole book about the benefits of it. And if you can hold it for, look after it for a day or something, it builds up so much more goodness, and drink it then. Oh my goodness. Do you believe that?
Uh, Urine is filtered through the body. It's as clean and pure as you can imagine. Now, it depends what you're eating and drinking.
Well, yeah, of course. She eats very, very clean. I
Yeah,
mean,
sure.
literally, and there's nothing of her.
Yeah, sure. It is really beneficial. A pint is huge. If I was chatting to someone who was going to go on the urine trip, I would suggest half a teaspoon in the morning. Yeah, and build it up and get used to it, because it is massively beneficial, because it is filtered, and you can do all right in it. You can. So, and urine therapy is practiced in India, and there's doctors in India who actually uh, practice urine therapy. So it's well known. And when you come from countries
Absolutely.
who don't have access to the pharmaceuticals, the dosh, that the Western world has, there's other ways to do things.
Wow. I mean, it
Um,
just the very thought of it, but I know she's absolutely adamant that that is a good thing to do. Anyway,
yeah, and lots of people cover the skin in it and use it for the hair, for the conditioner, and all sorts of stuff. Yeah. So, um, so check how much urine you're peeing out compared to what you're drinking. Um, yeah.
lovely. I think probably spent enough on that subject. Shall we, or do you want to say any more on that, Bill? Because there's
What
a
were the
few
other
more things.
symptoms?
Hmm?
What were the other symptoms? Sorry, Jackie.
Chronic pain. So we did that one. Individuals may experience muscle weakness, poor balance, and limitations in mobility.
That makes sense. Because if you're losing muscle tissue, you could have poor balance, because you get less strength to support the muscles. You could also have a falling conflict or something, other conflict in an ear going on, that cause you to have a ungainly gait, so to speak. But yeah, good.
I mean, just in knowing all what you've said there, it's got to be of benefit to anyone that's suffering any of those symptoms, just to open their minds to the thought it could be self-worth conflicts, and to look into that about healing yourself of what others think. Or
It's a big part of it, but it is for the musculoskeletal system. And this is why I always speak about in the workshops that self-worth issues are universal.
it is universal, 100.
And I've always said, I don't know if you were there any of the times I have, I've always said, I ask anyone in the room to put their hand up if they've never had a self-worth issue going. And by the way, I'm not putting my hand up. Everyone has.
Absolutely. I wouldn't think
We're human
anyone ever
beings.
has, have they?
No one has. I don't know if they're just too frightened, but no one ever has. Because we're human beings. We
Absolutely.
react.
And we have to go through that to realize what I guess, to what extent we are affected by that. When I gave a talk at the beginning of the month in at a Mind Body Spirit Fair, and I hadn't done a talk about happiness for a long time because I've trained as a happiness coach, and obviously self-worth is and all the quotes that you can get, and one of them is something like, it was a very long time before I stopped looking at myself through the eyes of others.
Very good.
Yeah. So, and then you repeat that just to really emphasize it. But yeah, very interesting and very good to have that awareness and then start looking at,
And when we come
knowing
to
how valuable you are and
yeah,
how.
absolutely huge. And when it comes to self-worth issues, try and let go of the judgment on yourself.
Mm.
That's the big step. To give ourselves a break, cut ourselves some slack, and go, oh, seems I'm running the self-worth story for now. Okay, let's work on this one. And always check out when the symptoms started, what were the first symptoms, where they were, and look at your circumstances and your relationship that were going on in your life back then. Because someone had to change for the symptoms to appear.
Mm-hmm.
They have to. Nothing happens in the human body or the mind without a cause. Nothing. Zero.
Do you think the benefits of grandparents bringing children up to a huge degree, just because of their life experience and that, and you're not still, because a lot of times parents are growing up with the children almost because it's such a new thing for them, if you know what I mean.
Sometimes the children overtake them.
Well, yes. But I mean, I do think it all depends who the grandparents are and what their
Yeah,
life has been
exactly.
like. Yeah. But I mean, I do think the experience in that of a grandparent, yeah, could be of huge, but my mum adored my boys, and anyway, so yeah, there could be benefits, you know, and that not
Yeah,
only that, I do believe, because I am a spiritualist, and I do believe you choose your parents and then you choose the family you're coming into as well for what you'll learn and grow from. Anyway,
you will.
yes. Okay, so the next thing I just wanted to touch on, if you would, is hay fever, because I know a lot of people at the moment are suffering with hay fever. I will just show this as well, because I did show Bill just before. So I was walking the dogs last night and I actually took a video. I don't know if that shows at all.
Just hold it there, Jackie.
Hmm?
Oh, stay there, stay there. Yep, you can see that.
Yes, you can see
All the
all
little
of that
floaties.
floaty, yeah. And I imagine that could possibly affect some people if you are affected with hay fever. My son is, and streaming eyes, very congested at the worst times when they say the pollen count is so high.
Okay, okay.
Mm.
So the question always to ask is whether the pollen count is high or not. Does everyone suffer it? Yes or no?
And they don't.
No. And it's common. Yes, absolutely. And troublesome for the people who do suffer from it, like any ailment. So we have to look at, but we'll have to ask one question. And you know the answer to this, Jackie, because you're the boy's mother. Has it always been sensitive to hay fever?
You know, I remember the first time when his eyes swelled up. He was young. We went to Swanage to meet my husband. He'd done a 26-mile walk around Swanage, and we were there at
Was it
the
lost?
end. It was for leukemia something or other. Anyway,
Okay,
leukemia busters. And he used to do it every year. But so anyway, he came when we were waiting in this field for him to come back. And oh my goodness, my son. So no, I'd not seen it before then. And he must have been about 8 then.
okay. And the symptoms then, was it just
But
the eyes or anything else?
eyes and well, it was just so uncomfortable. I remember we put my mum's dark glasses on him to see if that would help. And no, it was just all the head sort of nose congestion. But I hadn't remembered, I couldn't tell you before that he'd ever suffered with it.
Sure. And this is always a question, because really if we're sensitive to something, generally speaking, there has been times in our life before where we weren't sensitive to that. So again, you're looking at the parts of the body, the organs, the tissue types, whatever. So the eyes is some form of visual conflict, because it's the eyes. As in, I've lost sight of, or I can't see, or a separation type conflict, or I don't want to see, depending on what tissue type it is in the eyes. There's a visual conflict with those type of symptoms. And I would always look for separation at age 8, a visual separation. And separation issues are super common in society in different areas. And the top layer of skin, it be called eczema or dermatitis or something else, or even measles or something, and the healing phase. With the eyes, you get things like conjunctivitis and sort of things, resolution of separation conflicts, visual separation conflicts, and it could be in one eye or the other, depending on who it relates to, whether it's your partner, your mother, your child, or some other person. But a visual separation. Now,
No, that's just he'd lost his granddad, Joe's dad, around that time. I don't know, but I mean, that just come to my mind when you said that.
yeah,
Wow.
and depending how the son felt when he's waiting for his dad
Yeah.
to come round, and where he was at the time as a boy, and what was going on in his mind, and what's going on in your relationships around you, because was your mum there
Yeah.
who lost her husband?
Yeah.
Uh, uh,
Oh, no, sorry, my mum
oh,
was
that
there
was your mother,
already.
your mum,
Yeah,
right? Sorry.
yeah. No, his mum had already gone a long time ago.
Oh, okay, okay. So, and what did his mum? What did his granddad pass off? What?
Well, it was a shock, yeah. Gosh, it was a shock because, well, he was in a home on a respite week, and he died while he was at the home. So obviously, yeah, not being at home. But what was it? It was his stomach was solid. It was something about his stomach, and
Like a blockage in the colon or something?
yeah, yeah. I can't
Okay,
remember exactly. I know it was something about the flow of his body, right? But I mean, he was quite elderly as well. But
sure, sure. But uh, everyone wants to go in the sleep, don't they?
yeah,
Quite rightly so.
and in a way, I guess that was quite in it. It was like he'd waited to go away from the house before he died, if you know what I mean. Yeah, because he lived at home still. It was just a respite week for my sister-in-law.
Okay, okay. So the son potentially could have been affected by the visual loss,
Mm.
and And if we were sitting down and we had the time, Jackie, and your son was there as well, we were checking in how he felt, if he could remember. Because sometimes with separation issues, they affect our short-term memory as well. So, and what he could see in the surroundings, and is there any association with, and to do with the separation, the visual separation with his granddad, or anything like that, or did his granddad used to come to those walks or anything else? So there's any association, or smells, sights, sounds are huge in our psyche, because they're to warn us of impending danger.
Wow.
And our psyche is like the best iPhone or whatever in the world. It takes a snapshot of every millisecond of a negative event and stores it in the subconscious. The sights, the sounds, the smells, the taste, everything, even the temperature, the humidity, where the sun was, I mean, everything. It's stored in a computer bank of a subconscious mind. It's colossal. And basically, it's trying to protect us and keep us safe. Don't go there. Look what happened last time. And then that gets reactivated and reactivated and reactivated. So that the eyes are a visual. I would always go for separation conflict first. Okay. I don't want to see that, or I've lost sight of that, or something like this. So, and then the nose sort of area, then it's all about either smell danger, or I can't smell the person I want to smell. Because remember, smell and hearing and eyes are our survival programs in nature. They are essential. I mean, super essential. And when so it could be a smell danger, or something just a smell right, or the smell of something reminds us of something negative in the past. Whether it be a flower or a weed or manure in the field or whatever it is. That smell can warn us of impending danger because of what happened the last time. Now, it can also mean the situation stinks, literally. So we have to think from the senses of the organ, and why would that organ react? So, because different people with hay fever have different type of symptoms. Some people get digestive issues, some people get skin issues, some people get, as you say, the runny eyes and the runny nose, and maybe some people get the coughing, or some people just, everybody's different.
Yeah.
Now we've got to look at that time when your boy was 8 years old and what was going on around these sort of themes. And sometimes you don't know until you ask them, you go, what was going on back then for you? How did you feel? Whatever. And then from then on, then the smell becomes the track, or the sight of the pollen becomes the track, or a well-meaning person warning them that the pollen's high, or and back then we didn't know these words, did we? It's just like
No.
you know, you went out and you went through certain flowers or fields or whatever, as we did. Some kids got a reaction, but there had to be a negative experience in association with that smell, the sight, the sound, the taste, or what you see. Had to be. There's no other way around it. So then, from then on, that sight, sound, smell, taste, whatever, becomes a track. And then those tracks get added to over the years. So
Yeah.
other things come into the mix. Maybe you hear like the sound of a barking dog, or you may see a horse in the field next door, or you may smell the cow manure, or they get added to the tracks. And so it goes on. So we have to go back to the original time that happened and start looking there. So then we can, once you get the comprehension, the understanding of the cause back then, which is still stored. The subconscious mind is present tense, doesn't understand past and future. They understand the potential cause, what happened, where that person was at the time, and the present tense. Join those dots up, diminish, 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 to the point where you just go out and go, oh, it's a lovely high pollen day. Oh, goody. Sun's out. Imagine if someone was walking through a field of hay or some, as we used to do as kids, and they were told bad news. Or nowadays, it'd be somebody on the phone texting you something, or your boyfriend, your girlfriend's hanging out with somebody else. I saw them with somebody else last night. Bang. Now your phone's a track. That's a trigger.
Yeah.
And everything in your environment's a trigger. Say you're eating a cheese sandwich at the time. A cheese sandwich is now a track. Cheese sandwich is dangerous. What happened last time? It sounds really weird, but this is our subconscious mind. It
Yeah.
runs the show. Or maybe a smell, maybe a plane overhead. May have seen some white clouds around it. Bang, it's gone. It's gone. Everything, every snapshot, just as an experiment, go with your phone and take a snapshot. I know you love your photography, Jackie. And so go and take snapshots and then try and remember everything you took in that snapshot that's in that picture. And then look at it later and go, oh my gosh, I forgot that, or I forgot that, or I missed this, or I got that. Try and see everything. Oh, I didn't remember that barbed wire fence, or I didn't remember that key,
Mm-hmm.
or I didn't. Your subconscious mind has got everything in it,
Every bit of it.
to the nail in the gate.
Oh my goodness. You know, if I'm not using the computer for a while, it just starts bringing up all old photos that are stored on here. And there was a photo come up yesterday, and I said, oh, Joe, I don't remember. There's a fence right the way round. The dogs were inside this fence. And I said, where on earth was that? Yeah, so it did come back. I did know where it was. But yeah, you're absolutely right. That's amazing.
I
Just to be aware of that.
was,
The other thing I would like to say when you're saying about the phone, and I don't think we said it last week, but I know we've said it on previous videos, but it is so important if you're getting a diagnosis. Do you want to just mention that?
your phone can save your life.
Yes.
When we go for a diagnosis, it's like going to the witch doctor. If we believe in witch doctors, and the witch doctor used to point the stick at the villagers and they'd be dead in the morning because that was their belief. Then the white missionaries turned up, they didn't know the script, and they were up for breakfast in the morning. And the doctor in the white coat can do a similar number, not deliberately or nothing like that, just because it depends on our belief. Now, remember, if someone goes for a diagnosis, 9 times out of 10, unless they're really stoic, they're in fear to some degree, or at least concern. And otherwise, why do they become for a diagnosis? Sometimes people get caught out and they get a diagnosis slapped on them when they didn't ask for it. They're just doing a random so-called health test. Don't do that. I said that as gently as I can. Don't do that. So you might as well stop a traffic policeman in your car and ask him to check it over. It's guaranteed to find something wrong because that's what he's trained to do.
Yes.
You wouldn't do it. So, not medical advice, just a personal opinion. If you're going to go for a medical diagnosis, take a trusted friend with you, preferably the opposite sex. If it's a woman's issue, take a man who's not going to get triggered by any diagnosis, and make sure they are solid when you take them in. More solid, because you want to be passing everything on to them. Take your phone, put it on record, just audio, not video. Put it on record before you walk into the doctor's office. walk straight up to the doctor's desk, respectfully, everything's respectfully.
Okay.
And it's a human being doing a job. And put it on the phone and look the doctor right in the eye and say, you're asking a question, but you're really making a statement. I hope you don't mind me recording this, doctor, because my head's all over the place right now. I can't remember a thing. I don't want to miss anything important. Don't wait for the reply. Just go and sit down. That phone stays at that desk. Now, what you do is, and again, everything's respectful, you imagine your thoughts, that everything the doctor's saying goes into that phone. You can cleanse it later, that's no problem. It goes into that phone, recorded, it's an MP3, you can listen back. And you also say to the doctor, it's for my own personal use, not YouTube. Okay. Because
Absolutely.
that's a slight problem. So, and that's your legal right, by the way, to record the conversation for your own personal use.
Yes.
Now, one reason is energetically, you don't want those words to hit you because every word's a vibration. You don't want those words to hit you full on. Because depending on your past beliefs, your past story, the past what you've heard, what you've saw, what you've witnessed with other people you care about, you could be worrying and thinking back to them and thinking, oh, look what happened to that person. It's huge. It's huge. We're human beings. So that one part, the energy goes, vibrations go out to the phone. Or to the person you take with them, who has to be rock solid. And after that, you don't listen to him. In the doctor's office, look around the room, distract yourself, sit and go la 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 in your head like you used to do as a kid, you know, without the fingers and the ears. La 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 la, I don't want to hear that. That's the best possible thing you can do. Because people can suffer secondary conflicts by hearing that bad news that can affect different organs. That's the biggest danger. They could get a death threat conflict for themselves or anyone they care about, which could affect a big part of the lungs. They could get an existence starvation type conflict connected to a part of the liver. And they're both fine, they're both survivable. But if months later a doctor says, oh, it's spread to the lungs, it's spread to the liver, that's a tough call for someone. It's a second diagnosis that does a number on people. You can see them, even someone strong, going, yeah, I've got this, I've got this, I've got this, depending on what they're doing, what their belief, their faith is. Never take away anyone's hope, ever, ever, ever. Never try and take someone away to something else that they don't know about. You can't learn when you're in a place of fear. If someone's belief is in the medical system, support them in the medical system. If someone's belief is in alternative, I'll leave that one on the shelf. Personally, I would go to the person who knows the cause. Because if we don't know the cause, we'll never find a resolution. Okay. Bearing in mind that a lot of diagnosis is already a healing symptom. Not all, but a lot.
Yes.
Okay. So don't give up hope. So that's the gentlest thing we can possibly do. Now, what that also does is, again, respectfully, it causes the doctor to know it's been recorded. And most doctors or consultants, it makes them take a step backwards. And they use kinder words and explain it slowly and gently. Maybe less of an egotistical way, or like, I know best, whatever. And I feel for them. I'd hate to do the job and tell people bad news every day. I can imagine anything worse, ever. And most doctors end up in that profession because they originally cared.
Yes.
And find out too late sometimes they're in a system that sucks. And it's got to suck the life out of them.
Yes.
And realise they've got big streets on what they can say, what they can behave, what they can do, what they can administer, and how and when and where. It's tough. I speak to many doctors over the years, and it's a tough job.
Yes.
So, and there are people who shouldn't even work in an abattoir, to be honest, that wear a white coat, but then again, it's a different story. So this is what you do to protect yourself. And it causes the doctor to be more gentle with the news they're going to tell you.
Mm-hmm.
So it's a benefit all round.
All round. I love that information, and I've told so many people, you know, because you just wouldn't even think of it in general, would you, to take your phone in? But to know you've got the right because it's personal use, I love that.
There was a chap many years ago, not in this country, it was some I heard from Dr. Hammond himself, Dr. Heyman, not himself, but one of his case histories. And it was a chap, he was diagnosed with MS. And this guy wasn't having none of it. And he got up off the chair. I mean, most normal people would never do this, okay? And he smacked the doctor in the face. And he says, "You're talking, whatever, bullshit." And he stormed out. He never had any symptoms since then.
Oh, truth chills just went through then. Love that.
He refused to believe it.
Wow. Bill, thank you so much for doing this again this week. If we leave it there, I think next week, if we could talk about one of the things I'd like to talk about, and I don't know, it's gone through my mind while you were talking today, about gluten-free, dairy-free, all of those things as well. Like, yeah, just to touch on, because we never used to hear about such things. But now food allergies is such a massive thing where you go, wherever you go, they have to make it absolutely, you know, have you got any food allergies? And then the amount, I never used to be gluten-free, but I'm gluten-free now. So things like that. Yeah.
Very interesting.
Okay.
As you know, Jackie, I lived in Totnes around Totnes, but 4 miles away for many years. And trying to find a normal cake was so difficult.
Yeah.
So difficult. Everything's
Yeah.
gluten-free, sugar-free, dairy-free. And in my mind, it's free of flavour. But, you know, for a lot of people, that's what's right for them.
Absolutely. But just wonder why that would ever, because if they say, you know, I never used to be gluten-free, but now I am, what's happened? So we'll just look at that perhaps next week a little bit. Oh, I think you froze, Bill. I am going to have to go because I can hear my dogs crying. I think the door's blown shut. Yeah, Bill's frozen now. Okay, very grateful for today's talk, and we'll be here again next week.